You know that feeling, right? The blocked nose that just won't clear, that sort of pressure building up behind your eyes, maybe even a headache that just hangs around.
Hmm.
So many people deal with this. Nasal allergies, sinusitis, these related headaches. They're incredibly common, and honestly, they can really mess up your day.
Absolutely.
Yeah.
They really can impact your quality of life.
So today, we're really going to dive deep into this. We want to understand what's going on, the causes, treatments, and importantly, what we can actually do about it.
Exactly. We're digging into some great insights from a health discussion featuring Dr. Mohammad Shahriar Arafat. He's an expert in this field, otolaryngology at Dhaka Medical College Hospital, and also consults at BRB Hospital.
Right. So we're drawing from some real expert knowledge here. We'll be looking at, the basics, definitions,
Yeah.
causes.
Things like genetics, which
Right.
play a bigger role than some might think, and those environmental triggers everywhere. Pollen, dust mites, pet dander.
Uh-huh. And treatments too, right? From medications to surgery.
Yes, and we'll also try to clear up some common confusion, like that whole nasal polyps versus enlarged turbinates thing.
Yeah,
People often mix those up.
that's a good one. So the goal for everyone listening is really clarity. These conditions can feel, well, confusing.
Hmm.
We want to give you practical knowledge, help you understand maybe what's happening with you, and make better decisions about your health.
So our mission, if you like, is to pull out the most critical stuff from that expert discussion, give you a solid, easy-to-grasp understanding.
Okay, let's get started. Where should we begin? Maybe with nasal allergy itself. Allergic rhinitis.
Good place to start. Yeah, allergic rhinitis.
Mhm.
It helps to remember just how sensitive our noses actually are. They're kind of the front line, constantly exposed to everything in the air.
Right, every breath pulls stuff in, pollen, dust,
Right.
those tiny dust mites in bedding, pet hair.
Exactly. And for people who are susceptible, their nasal lining, the mucous membrane, gets irritated by these allergens.
And it's not always just a spring thing, is it?
No, that's a key point. We often think seasonal allergies,
Mm.
tree pollen in spring, ragweed in fall. But then there's perennial allergies.
Meaning year round.
Yeah, often triggered by things inside our homes. Dust mites are a big one, pet dander, even mold spores if you've got damp areas.
And you mentioned genetics playing a role?
Hmm. A significant one. The discussion we're drawing on highlighted some interesting stats. If one parent has allergic rhinitis, you've got about a 25% chance of developing it yourself.
Okay, 1 in 4.
But if both parents have it, that risk jumps quite a bit, up to around 47%.
Wow, nearly half. So it really shows that family history matters here.
It does. It suggests that if allergies run in your family, you might want to be extra mindful of those environmental triggers, maybe even take some preventative steps.
So it's this mix then. Your genes sort of load the gun.
And the environment pulls the trigger. Yeah,
Yeah.
that's a good way to put it. It's that combination of your predisposition and what you're actually exposed to.
So besides pollen, dust mites, pet dander, mold, are there other common triggers we should know about?
Well, those are the main respiratory ones. Sometimes specific foods can trigger or worsen nasal symptoms for some people, but the big environmental ones are definitely dust, mites, dander, pollens, and molds.
And everyone reacts differently, right? Some people barely notice, others are really knocked out by it.
Absolutely. The severity, the frequency, it varies hugely. Depends on your specific sensitivity and how much of the allergen you're encountering.
Now, you mentioned the source material had listener questions. That's great. One that came up was about nasal polyps and non-surgical treatments. You said there's some confusion there.
Yes, this is really important. Often, what someone thinks are nasal polyps might actually be enlarged nasal turbinates.
Turbinates, what are those exactly?
Okay, so turbinates are normal structures inside your nose. Think of them like small, bony shells covered in tissue. Their job is to warm, humidify, and filter the air you breathe. Very important.
Okay, so they're supposed to be there. Why would they get enlarged?
One common reason is if the nasal septum, that's the wall dividing your nostrils, is deviated or bent. If it bends to one side, the space on the other side becomes wider.
Ah, okay.
And sometimes the turbinates on that wider side enlarge. It's called hypertrophy. It's almost like they're trying to fill the extra space to regulate airflow.
So that enlargement can cause blockage, making someone think they have polyps.
Exactly. But it's different from true nasal polyps,
Mm,
which are more like teardrop-shaped growths, often linked to chronic inflammation or allergy.
got it. So if it is enlarged turbinates causing the problem, what's the treatment plan?
Well, the first step is usually medical management, trying medications, often nasal steroid sprays, to reduce the swelling.
And if that doesn't work?
Then surgical options might be considered, things like turbinate reduction, physically making them smaller, or using heat, diathermy, to shrink the tissue. Sometimes correcting the deviated septum itself can help the turbinates return to a more normal size.
Okay, so different approaches depending on whether it's turbinates or true polyps. That makes sense.
Right.
Another big question people have, I'm sure, is about a permanent cure for allergies. Is that something that's actually possible?
Ah, the million-dollar question. The expert in our source used a really good analogy. Managing allergies is often like managing high blood pressure or diabetes.
Meaning, it's about control, not necessarily a one and done cure.
Generally, yes. The focus is typically on controlling the symptoms and minimizing the impact on your life. We have really effective tools for that.
Like what?
Medications are the mainstay for many. Antihistamines block the histamine reaction, Montelukast helps with airway inflammation, and nasal corticosteroids directly reduce nasal inflammation. These work really well for symptom management.
Are there longer term options?
There are. Allergy testing is key, finding out exactly what you're allergic to. Then for some specific allergies, there's immunotherapy, often called allergy shots, or newer under-the-tongue tablets. These gradually desensitize your body over time.
And surgery. Is that ever an option for allergies themselves?
Surgery isn't usually for the allergy itself, but sometimes structural issues, like severely enlarged turbinates or a deviated septum, can make allergy symptoms much worse. Fixing those surgically can definitely improve things, but it doesn't cure the underlying allergic tendency.
What about taking allergy meds long term? People sometimes worry about that.
That's a valid concern. The expert did address this, noting that the commonly used meds, antihistamines, nasal steroids, Montelukast generally have a good safety profile for long-term use when prescribed and monitored by a doctor.
So generally safe under guidance.
Yes, the side effects are usually minimal for most people, but it's always best to discuss any concerns with your doctor, of course.
Okay, let's switch gears slightly to sinusitis. We hear that term a lot. Can you break down what it actually is?
Sure, sinusitis is, simply put, inflammation of the sinuses.
And the sinuses are what exactly? Where are they?
They're basically air-filled pockets or cavities within the bones of your face and skull. The main ones are the maxillary sinuses in your cheekbones, the ethmoidal sinuses between your eyes, and the sphenoid sinuses, which are further back, deeper in the skull.
They're filled pockets. Okay, so how does having allergies lead to those getting inflamed? What's the link?
It's a very common pathway. When allergic rhinitis flares up, you get that nasal inflammation and increased mucus production we talked about.
Right.
That swelling can block the tiny drainage holes that connect your sinuses to your nasal cavity.
Ah, like a plumbing problem.
Exactly. Mucus gets trapped inside the sinuses. It can't drain out. That stagnant mucus is a perfect breeding ground for bacteria or viruses.
And that leads to the infection and inflammation we call sinusitis.
Precisely. The allergy starts the process by blocking the drains, and then infection can set in.
So what are the telltale signs? How would someone know they might have sinusitis, not just a cold or allergies?
The symptoms often overlap, which can be confusing. But classic signs of sinusitis include a headache that's often worse in the morning,
Okay.
persistent nasal congestion or stuffiness, thick nasal discharge, maybe yellowish or greenish, and facial pain or pressure. You might feel it around your cheeks, eyes, or forehead, depending on which sinuses are affected.
That facial pressure sounds really uncomfortable.
It can be quite significant, yeah.
So if someone's got those symptoms, what's the diagnostic process usually look like?
It starts with a doctor taking a thorough history of your symptoms and doing a clinical exam, maybe looking inside the nose.
Right.
Sometimes an initial x-ray of the sinuses might be done. But for a more detailed look, especially if it's chronic or recurrent,
Yes.
a CT scan is often the gold standard. It gives really clear pictures of the sinus anatomy and any inflammation or blockages. Nasal endoscopy is also common.
What's that about?
That's where the doctor uses a thin, flexible tube with a tiny camera on the end to look directly inside your nasal passages and sinus openings. They can see inflammation, discharge, maybe even polyps.
Okay, so a few different ways to figure it out. And once sinusitis is diagnosed, what are the treatments?
Well, it depends if it's acute or chronic and what's causing it. If it's thought to be bacterial, antibiotics might be prescribed.
Okay.
But often, especially if linked to allergies, the focus is on reducing inflammation and improving drainage. So nasal corticosteroids are key. Antihistamines and Montelukast might be used if allergies are a trigger. Saline rinses can also help flush things out.
What about when medical treatments aren't enough? You mentioned surgery earlier.
Right. For chronic or recurrent sinusitis that doesn't respond well to medication, or if there are significant blockages like polyps, functional endoscopic sinus surgery, FESS, might be recommended.
And FESS is?
It's minimally invasive surgery done through the nostrils using an endoscope, that camera we mentioned. The goal is to carefully open up the blocked sinus pathways and remove any diseased tissue or polyps, restoring normal drainage and ventilation.
Does that surgery provide a permanent fix?
It can provide really significant, long-lasting relief for many people, but, and this is important, if there's an underlying allergy problem that isn't managed.
The sinusitis could potentially come back.
It's possible, yes. That's why post-surgery, continuing to manage any allergies with medication and avoidance strategies is usually really crucial for long-term success. Surgery fixes the plumbing, but you still need to address the underlying cause of the inflammation if possible.
Let's circle back to headaches for a moment. We said sinusitis can cause them. How direct is that link?
It's a well-recognized link. Sinusitis causes inflammation and pressure buildup inside those bony cavities. That pressure can irritate nearby nerves, leading directly to pain that we feel as a headache. The pattern is often that morning headache, maybe easing up a bit as the day goes on, and accompanied by those other nasal symptoms: congestion, discharge, facial pressure.
But, important point, not every headache is a sinus headache, correct?
Absolutely, is the central point. Headaches are complex: migraines, tension headaches, dehydration, lack of sleep, lots of potential causes.
So how do you tell the difference?
If the headache consistently comes with significant nasal symptoms, blockage, thick discharge, facial pain, maybe even fever, then sinusitis is a strong suspect. If it's just head pain without those other things, it's more likely something else.
And if someone does have persistent headaches with nasal symptoms?
Definitely worth getting it checked out by a doctor. They might recommend investigations, maybe that CT scan, to see what's going on in the sinuses.
Okay, this is all really helpful in understanding the conditions. What about prevention? What can people actively do to try and avoid developing allergies or sinusitis?
Prevention really hinges on allergen avoidance, especially if you know you're allergic. This is probably the most powerful strategy.
So practical steps.
For dust mites,
Yeah.
use those special allergen-proof covers on pillows and mattresses. Wash bedding frequently in hot water. Keep humidity down.
Okay. What about general dust?
Regular cleaning, obviously. Maybe consider hard flooring instead of carpets, which can trap a lot of allergens. If you're doing dusty chores, wear a mask.
Makes sense. Pets.
If you're allergic, ideally, minimize contact. Keep pets out of the bedroom at least. Wash hands after petting them. Air purifiers might help a bit.
Right. And you mentioned food allergies earlier.
Yes, if specific foods are identified as triggers, then strict avoidance is necessary. It's all about reducing your exposure to whatever sets off your reaction.
It sounds like managing your home environment is pretty key.
It really can make a huge difference for many allergy sufferers. And beyond avoidance, the expert really stressed seeking timely medical advice.
Why is that so critical?
To get an accurate diagnosis, for one, and to avoid complications. Trying unproven or potentially harmful self-treatments, the expert mentioned people trying things like acids in the nose, which is incredibly dangerous, is a bad idea.
Definitely sounds dangerous.
Yeah. Seeing an ENT specialist early, if symptoms are persistent or severe, is the way to go. Get proper advice, avoid misinformation.
That leads nicely to a point you raised earlier, avoiding self-treatment. What should listeners be thinking about to make sure they're getting reliable advice?
Well, first, recognizing when symptoms go beyond a simple cold. If it's lasting weeks, if it's severe, if it keeps coming back, don't just keep trying over-the-counter stuff indefinitely.
Go see a professional.
Exactly.
Yeah.
Primary care doctor is a good start, and they can refer to an ENT specialist if needed. Trust qualified healthcare providers, not just something you read online somewhere.
Good advice. Were there any mentions of recent treatment advancements in the source material?
Briefly, yes. Image-guided sinus surgery was mentioned.
How does that work?
It's basically using sophisticated tracking systems, often linked to a preoperative CT scan, almost like a GPS for the surgeon's instruments inside the nose and sinuses.
For increased precision.
Exactly. It helps the surgeon navigate complex anatomy very accurately, which can be particularly useful in revision surgeries or difficult cases. It's available in many major hospitals now.
Interesting. Another really important topic that came up was antibiotics. Are they used too often for sinus issues?
That was a major point of emphasis. The expert highlighted that many, probably most, initial sinus infections are viral.
And antibiotics don't work on viruses.
Correct. They only work on bacteria. So for allergy-related sinus inflammation, things like antihistamines, Malucist, and nasal steroids are often more appropriate initially.
When should antibiotics be used then?
They're typically reserved for cases where a bacterial infection is strongly suspected, may be indicated by high fever, severe, one-sided facial pain, worsening symptoms after initial improvement, or symptoms lasting beyond 7-10 days without getting better.
And the danger of overusing them.
It's huge. It contributes massively to antibiotic resistance, where bacteria evolve to survive the drugs. This makes future infections much harder to treat, not just for you, but for everyone. And always finish the full course if prescribed. Don't stop early just because you feel better.
Crucial advice. Lastly, there was a specific warning about certain nasal drops, the over-the-counter kind.
Yes, a very strong caution about decongestant nasal drops, the ones containing ingredients like oxymetazoline or xylometazoline. People often grab these for quick relief from a stuffy nose.
They work fast, don't they?
They do, initially. But the experts stressed, do not use them for more than a few days, maximum maybe a week, unless explicitly told otherwise by your doctor.
Or not what happens.
If you overuse them, you can get something called rhinitis medicamentosa. It's a rebound effect. The drops stop working, and your nose actually becomes more congested, leading you to use the drops even more. It's a nasty cycle.
Wow, so the thing you're using to fix the problem actually makes it worse long term.
Precisely. So use them only for very short periods for acute congestion, and always follow the instructions or your doctor's advice. Stick to saline sprays or prescribed steroid sprays for longer-term management.
Okay, that's a really practical warning. So wrapping things up, what are the absolute key messages you want our listeners to take away from this deep dive?
I think the main things are: 1, nasal allergies and sinusitis are super common, but they're manageable. 2, understanding your triggers, what sets you off, is vital.
Right.
3, get a proper diagnosis. Don't just guess. 4, stick with the treatment plan your doctor recommends. And 5, prevention, especially avoiding allergens you know affect you, is incredibly important. Long-term relief often really depends on managing those underlying allergies.
That's a great summary. It really hits home how these things connect. So here's something to maybe think about after listening. Considering those common indoor allergens, dust mites, pets, mold, what's one small, realistic change you could maybe try making in your home environment to see if it helps reduce any allergy symptoms you might have?
And perhaps also thinking about that advice on seeking proper medical help. What steps can you personally take to make sure you're reaching out to qualified professionals for any nasal issues that just seem to hang around, rather than just trying to tough it out or rely on Dr. Google?
Excellent points. This deep dive really just scratches the surface, doesn't it? If you are dealing with persistent symptoms, please do consult your own doctor for personalized advice and investigation. Thanks so much for joining us today.